Do other first-line drugs leave you feeling hopeless in emergency situations? Are you constantly anxious about being unable to elevate your patient's heart rate? Tired of not being able to correct your patient's hemodynamic stability issues during a code blue? Then maybe you're ready for the wonder drug, Zetramax. Zetramax is a new pharmaceutical derived from the belladonna plant that is guaranteed to get the job done in acute situations. How does Zetramax work? Zetramax prevents a substance in your body called acetylcholine from binding to its receptor sites and allowing the parasympathetic nervous system to overcome the sympathetic nervous system. The parasympathetic nervous system causes your eyes and airways to constrict. It also causes your blood vessels to dilate, causing blood pressure to drop and heart rate to slow. The digestive system begins operating, causing frequent excretions and urination. Don't you hate it when a patient becomes asystole or their heart rate drops below baseline? Have you spent moments wishing there was a more effective drug you could administer during resuscitation? Well, now, there's Zetramax. This means dilated eyes for better vision and increased heart rate to prevent bradycardia and asystole. No more drooling for your patients. Zetramax decreases saliva and phlegm production and even helps prevent stomach spasms. But wait, that's not all. Zetramax even prevents diaphoreses, tremors, and intense laughing and crying episodes brought about by brain tumors. Zetramax can raise systolic and diastolic pressures in even the most severe hypotensive patients. Zetramax can be used on most patients in need. Use Zetramax in CPR situations to stabilize patients' heart arrhythmias. On Parkinson's disease patients to control their frequent tremors and rigidity. On babies to prevent excess salivation, or even the elderly to control their pesky and demanding digestive systems. Only take the recommended dosages of Zetramax as prescribed by your physician. Zetramax has not been tested on expecting mothers. Do not take this drug without first consulting your physician if you are pregnant. It is not known whether Zetramax passes into breast milk. Do not take Zetramax without first consulting your physician if you are breastfeeding. Zetramax is versatile and comes in a pill and syringe form for easy administration. Pop it under your tongue, inject it parenterally, or dump it right down your patient's endotracheal tube. The pill and syringe are instantly recognizable. In a pinch, you'll always know when you're using Zetramax. But don't take our word for it.
Hello, my name is June Miranda. I represent the new drug Zetramax, and I'm here to talk to you about why Zetramax is the best choice anticholinergic today.
Zetramax uses the newest pharmaceutical technologies, limiting additives and utilizing the natural derivatives of the belladonna plant for a better, more holistic effect on patients. This means a wider range of use in patient care.
Hello, my name is Harutian Menetsian. I've been working in UCLA ICU for about 15 years, and let me tell you that in that hospital we used to use atropine, but now we use the new drug called Zetramax. It has improved the patient quality of life. What I like about this drug Zetramax is that it has been also used for many of my Parkinson's patients. And I've seen a lot of decreased tremors, and I've also seen depressed salivary gland action that reduces the drooling without drying the mouth completely.
Getting treatments with Zetramax, I have had increasingly less spasms and sweating. These are things that would potentially inhibit me from day to day. I'm so thankful that Zetramax has helped me to cope with this debilitating disease. Thank you, Zetramax.
The leading anti-muscarinic brands such as Minim's atropine and atropine sulfate can cause harmful side effects. You can use Zetramax on the elderly and on children without worry of worsening conditions.
One of the reasons why we decided to use Zetramax instead of atropine is because with atropine, one of the side effects is urinary retention. And you know, fluid balance is very important for the patient recovery. And the good thing about Zetramax is that it does not have any effect on the urinary output. Rotations in different places. And so far I can say that this drug that have been used, Zetramax, has been approved by me.
Zetramax has a wide variety of uses. It can be used for irritable bowel syndrome to help control gastrointestinal effects, to help control excessive salivary gland production and lazy eye in children, to maintain adequate heart rate and blood pressure in the elderly, to control sweating and shaking in Parkinson's disease patients, and many more.
Due to some changes in the hospital policy, we now use Zetramax because atropine had many side effects and it wasn't that good for the patient. Instead, Zetramax has made it better.
Zetramax comes in the standard atropine dose in pre-filled syringes or tablet form, so it's easy for patients and practitioners alike. There's no reason not to switch to Zetramax.
You can't go wrong with Zetramax. Do not take Zetramax if you have kidney disease, difficulty urinating, intestinal blockage, glaucoma, or myasthenia gravis. Before taking this medication, inform your doctor if you have numbness or tingling in your hands or feet, liver disease, thyroid problems, high blood pressure, irregular heartbeat, or any type of heart disease, enlargement of the prostate, asthma, chronic lung disease, or allergies. Side effects include dry mouth, blurred vision, light sensitivity, dehydration, heat intolerance, constipation, palpitations, and tachycardia.